Good morning, everyone. I'm Muriel Bowser. I'm the Mayor of Washington, D.C., and today I will provide an update on the district's response to COVID-19, as well as a new mayor's order that I will sign today. I'm joined by members of my public health and emergency response teams. I want to remind everyone that we have updated our testing schedule for the rest of the summer to make best use of our time and the expected hot weather. So for the rest of the summer, the Anacostia, UDC at Fort Totten, and Judiciary Square testing sites will open earlier. Will open from 8 a.m. until noon. This morning, however, those sites won't be available because of the expected inclement weather. Our firehouse sites will continue to operate from 4 p.m. To 8 p.m. on Monday through Friday and 12 noon to 4 p.m. on Saturday. So if the heat index hits 100 degrees, the daytime walk-up sites will close. And if there is inclement weather in the evening, firehouse testing site decisions will be made by location. So the bottom line is that we're moving our walk-up sites to earlier in the day when it's less hot from 8 a.m. to noon, and follow the heat index, because that means that we will have to close on those sites if the heat index hits 100 degrees. You will always be able to know about testing near you in your neighborhood at the walk-up sites that we consider the citywide sites by going to coronavirus.dc.gov. This morning, we announced 78 new cases of COVID-19 in the district. And thankfully, we report no additional lives lost. We are showing on this slide the various metrics that we follow throughout our experience with COVID. One number that I think we report on our website but haven't highlighted here is that 9,582 DC residents have been cleared from isolation who have been positive for COVID-19, which is also a very good thing. And then Dr. Nesbitt will be available for questions about those metrics. As we look at the data and consider these trends, I want to remind DC residents that we always knew that when we reopened, we would have more cases. We also know that as testing increases, that we see more cases. And we knew, of course, that our life and economy would be hampered until we have a vaccine or cure. That's why we have always talked about reopening as a dial that could be turned up or turned down, depending on what our experience are. We said all along that we may need to make adjustments along the way, and that this process requires flexibility. We know, however, that we have in our individual ability, and certainly in our collective ability, we are able to stop the spread of the virus. And so since we've been talking about these things for many months, I think that they're becoming background noise in some ways, but we can't allow ourselves not to remember how important these activities are in stopping the spread of the virus. And this is what all of the public health experts say that we should do. So let me just remind everyone of these things. Wearing a mask is certainly going to help us as a community stop the spread of the virus. I issued a an additional mask order this past week, and I want to thank all the DC residents who pick up their masks before leaving the house, don their mask when they know they can't be 6 foot apart from other people, and it has just become part of everyone's routine. You grab your keys, you grab your purse, you grab your mask. You grab the dog leash, you grab your mask. All of those things are becoming second nature to all of us. So let's just be vigilant in doing all of those things. Social distancing. Just remember that we should stay 6 foot apart from each other. Also remember, it's not rude to not shake hands, to give hugs or kisses. Just remember, we have now been doing not being able to embrace our friends and people that we encounter for 4 months, and we may becoming a little bit lax about that. So remember how important it is to social distance. Stay home as much as possible. We have been able to turn on various activities because after 4 months, many people need those activities. That doesn't mean you have to do them all at once, all in the same day, or multiple times a week. So continue to think about how you can order your day, order your week, so that you're making one trip to the grocery store, and that you're mixing up your activities so you're not cramming them in to one day. The question I like to ask myself is, do I really need to be doing this? Do I really need to be going there? And also continuing to practice good hand hygiene, remembering all of those tips that we have come to know in terms of keeping frequently used items sanitized, frequently used parts of our house like doorknobs and countertops and bathrooms, all of those things sanitized. So please remember, all of these things can stop the spread. I emphasize these because I know, even as conscious as I am of all of these things, a couple of days last week, I walked right out the front door without having grabbed my mask with my keys in my purse and had to turn around and go back. So we just have to recommit to doing all of these things that keep us safe. And also, feel free to remind your friends or family of this list as well. We're doing this because we already have seen in our own experience and in places around our country what COVID has done to communities. We know that vulnerable people in our communities are most impacted by death related to COVID. And so we have to do everything that we can to keep vulnerable people in our communities safe. From the district's perspective, we are responsible in some way for a lot of vulnerable residents. They may be living in one of our shelters. They may be at the DC jail. They may be supported by one of our programs because they are seniors living in a long-term care facility. We have spent the last several months being very focused how to keep people who are vulnerable and in our care from getting COVID, and I'm very, very proud of the work that this team has done, whether it's in an isolation plan and quarantine plan, a testing plan, and so we continue to be very focused on these populations. But when we keep the spread of the virus out of our communities, we also help these populations, because every one of these congregate care sites is supported by workers who live out in the community. And if the virus is circulating out in the community, these workers that support these vulnerable populations are more likely to get the disease. We also have a shared responsibility to prevent the loss of life in our neighborhood. So we don't want to become jaded by simply reporting a number out every day, that it was only one person or only two people, or today you didn't have any people die, but That's doesn't reflect how concerned we have been about the over 500 DC residents who have died, their families, their coworkers, and the fact that many of us know somebody who's been touched by this virus. These are mothers and fathers, neighbors, coworkers, sons and daughters, people, but for COVID, who may have had more time to live their lives in DC. We also know that grief and trauma and anxiety have also accompanied this loss of life in our communities, and we see it in various ways that grief and trauma and anxiety is showing up. So everything that we're focused on is making sure, when it comes to loss of life, is keeping people from contracting the virus, but also making sure that we have the hospital supports that are there. That are available in our communities to help people if they contract this virus. And also, if they have another illness that requires them to be at the hospital, that there's ample resources for them there as well. We also know that we need to get our young people back to school when it is safe to do so. And as I said the other day, we don't know what impact being out of school for months is having on our children, but we know it can't be good. It's not good academically, socially, or emotionally. So everything that we do to stop the spread of the virus, get our kids back to school, gets us one step closer to normality in our community. We need to make sure our entire community is doing everything we can to get this under control so that kids and their teachers and their peers can get back to school. So I've heard too many stories from parents to know to share today, but we're thinking about a kindergartner whose learning to read was abruptly stopped when in-person learning in our school stopped. Now, certainly, we are proud of the online learning that has been happening in our schools, but I don't think that anybody would suggest that it is an adequate replacement for kids being at school in front of their teachers, with their colleagues, learning the ABCs, but also learning how to be good people. And of course, we want to do everything that we can to save our small and local businesses, and they are the backbone of our economy. Yesterday, or a couple days ago, I heard a business leader say that there's not any amount of government relief in the world that is going to change my business right now. What's going to change my business is people being confident that they can use my business safely. And so we, in doing our part in driving down this virus and how it's circulating in our communities, will begin to give our businesses confidence that we're going to come back to them and that they are going to be able to provide those services that they love so well. And so it breaks my heart, and you probably have heard me say this before, and you probably feel the same way, to drive around in our city and see once vibrant streets with no traffic, no people moving around, businesses, restaurants that were bustling without patrons. So all of those things, and when we ask you to do these things, and even when we say tough things that might inconvenience you, let's remember why we're doing it. We're doing it to save vulnerable people, to keep people in DC from dying, to get our kids back to school, and to get our businesses thriving again. That's why I signed a mayor's order on Thursday that requires people to wear a mask when they leave their home. It has several exceptions, but for the most part, it means that if you see someone outside in public, they should have on a mask. We're going to continue to spread the word about this so that everyone understands what is expected of them. And another place we think that we can do better is around travel. You heard Dr. Nesbitt mention on Wednesday some concerns that we have that DC Health has had around people traveling to other parts of the country and coming to DC. So we know, unfortunately, that there are states that are seeing significant spikes in new cases. We know that there are places where people are not being as cautious or making the sacrifices that we're making here in DC. And unfortunately, when people travel in and out of DC from these places, that can put our community's health at risk. So today, I'll be signing a mayor's order that requires people to self-quarantine after non-essential travel to high-risk areas. Beginning on July 27, anyone coming, that's this Monday, anyone coming into Washington, D.C. from a high-risk area who is not traveling for essential activities will be required to self-quarantine for 14 days. This order does not apply to our neighboring states in Maryland and Virginia. DC Health will publish a list of high-risk areas on coronavirus.dc.gov every 2 weeks, beginning Monday. Additionally, if people come into Washington from a high-risk area because they are returning home after performing an essential duty, or because they are coming here to perform an essential duty, in other words, if they are essential travelers, we still ask them to be more vigilant. They should only leave home or where they're staying to perform the essential activities related to their travel. So the obvious question may be, what is a high-risk area? And DC Health will have a metric that on a 7-day average demonstrates what a high-risk area is. And once again, beginning Monday, they will post that list every 2 weeks. Another question people may have is, how will this affect DC colleges and universities? I have met over the past several weeks with all of our university presidents, and we are working together to finalize their reopening plans and will continue to meet regularly. And today, we are sending a letter to the university presidents regarding their plans for reopening that contain further guidance. So in addition, the letter clarifies that students arriving from high-risk areas will also be required to self-quarantine on their campus or in their off-campus housing. And so before we wrap up and take questions, I also want to share with residents and businesses a few sectors, a few buckets of activity that we are watching closely. At the moment, we don't have clear trends to point to one sector or one bucket activity as the one that is most significant in our experience with COVID. Rather, there are a number of activities that we will be watching to see if we need to dial back any portion of these activities. Those include personal services, indoor dining, the 50-person gathering limit, recreational sports, and elective hospital procedures. And so with that, I will turn to questions related to the district's response to COVID. Yes. Stephanie.
With the announcement made today on travel, how seriously should people expect this to be enforced? And also, can you go through and just name some of the hot spots now for folks wanting to prepare ahead of Monday? And one last question in that area, why is this effective through October 9th and not just, maybe for a couple of weeks to see how things go?
We made it effective October the 9th is our current public health emergency, and we can, if we don't think we need it, we can dial it back at any time. And the first part of your question was, can we talk about some of the hot spots now?
How seriously should people expect this to be enforced? How will it be enforced?
People should expect seriously to monitor their activities and do what is right for their neighbors and the district. Yes.
So if I could stay on that enforcement, and if I could, and I really appreciate that you gave us the order in advance today for us to look at this. It's very helpful. But if you look at page 3 under enforcement, under number 1, where it looks at the responsibility for businesses and colleges and whatnot, you use the word may require rather than shall, which seems to be a big difference. And then under enforcement, you refer back to another clause, but it doesn't actually say what that is. Is there a possible fine associated with this if people violate it or anything? I don't know what number 2 actually refers to.
Let me pull, as we talk, Mark, the enforcement section, and let me be clear about that. The reference. I'll come back to you.
How do you, will it be incumbent upon colleges or hotels to enforce that if they have somebody traveling from out of town, that they need to self-quarantine? How do you enforce
Yeah,
this?
so for our colleges and universities, we will require that they maintain a list of students who will be required to quarantine because of their travel. And that list would have to be available for inspection. And the notion of having travel restrictions is not new. We see states around the country who have already implemented it. There's nobody standing at the hotel door telling people if they can come or go, but certainly they will be required to make all of their travelers aware of the guidelines of the local jurisdiction. For our own residents, what we're asking them to do is to say, do I need to make this trip if this is a non-essential trip? And if I am going to make this trip, I need to recognize that when I come back, I can't have my decision to make a non-essential trip affect my neighbors or my community. So when I make that decision to make that non-essential trip to a hot spot, I have to also be prepared to restrict my activities. So again, do I think that, my next door neighbor is going to call the police and say, they went to Florida, you got to make sure they stay in their house? No, don't be ridiculous. I think that's not going to happen. But we should be asking our social circles, our family, our work colleagues, you're making a non-essential trip, you're going to a hot spot, why are you doing that? That'd be the first thing I'd say. Why are you doing that? And you do know that when you get back, you have to stay in your house, because if you start circulating to the grocery store or to the family cookout or to work, that you could be infecting other people. Yes?
What is not essential? Well, let me say, what is essential?
We have a list, and where's Tomas? Can you come? We, as you know, when we restricted non-essential business, we identified what essential business activity was. We also identified what essential travel was. And this is Mayor's Order 2020-081. No, this is not the one I want, Tomas. I want he's going to get the other one. I'll read out the list of essential travel.
What's considered essential?
I don't want to be general. I want to be specific. So I'll read it for you. Give me 1 second. Yes.
Can I ask about how this affects some groups in our city? First of all, how does this affect the Washington Nationals, who are traveling to away games, and every team who comes to play them has come from somewhere else?
The Washington Nationals has been issued a waiver, and I'm going to ask Chris to talk about what that waiver entails.
So thank you, Mayor. When we issued the waiver for the Washington Nationals, we define their activities as essential,
Oh,
right?
I have it.
Oh, sorry. Okay.
I'm sorry.
No,
Just
that's
tell,
okay.
so he's looking for something that I have sitting
So
here.
that would be essential travel for business.
That means essentially all season long, all of the nationals need to be at home when they're not going to work or going to essential activities.
Yes.
Okay, and can I also ask about members of Congress who are going home? To
Let
their-
me read essential travel. I'm sorry, Sam, I had it sitting here and I didn't realize it. So this is from Mayor's Order 2020-054 that defines essential travel, and it is A through H. And A, travel related to the provision or access to essential activities, essential government functions, essential business, or minimum basic business operations, including travel to and from work. Travel to care for elderly, minors, dependents, persons with disabilities, or other vulnerable persons. Travel required to visit a house of worship. Travel to or from educational institutions for purposes of receiving materials, distance learning, receiving meals, and any other related services. Travel to or return to a place of residence from outside of Washington, D.C. Travel required by law enforcement and or court order. Travel required for non-residents to return to their place of residence outside of Washington, D.C., and travel within Washington region to engage in allowable activities. So those are essential travel. Your question about the Congress, that is an essential government function.
So I guess my question is, so if it's essential, you come back, you don't have to quarantine?
If you go back to the slide that talks about what essential travelers should be doing. Are you with me back there?
So that includes members of Congress need to stay home when they're not going to their essential activities.
So what we've asked for essential travelers, members of Congress, they're doing essential government work, is that they should leave home when they are doing their essential activities. Yes.
Dr. Nesbitt, could you clarify elective procedures in terms of potential dialbacks?
Sure. So you may recall that when we were in phase 0 and I believe phase 1, we had, no, phase 0, not phase 1. Phase 1, we began to have a little bit more of a relaxed posture. We had concerns about hospital capacity related to medical surge, as well as personal protective equipment and the availability of personal protective equipment for our entire health ecosystem. Well, we've had some change in the medical supply chains where personal protective equipment is more widely available, but as we change the trajectory, we have more cases being diagnosed. If we have more COVID-related admissions in our hospital capacity, which was one of the metrics where we are having some concern, if that overall hospital capacity continues to increase, not just as a function of COVID-related admissions, but of overall admissions, one of the things that we can do to be able to accommodate more COVID-related admissions is to ask the healthcare facilities to restrict elective procedures. Now, it's a decision between the treating physician and the patient to make a decision about what is non-emergency versus elective. There are some procedures that are clearly elective and widely agreed upon as elective in the medical community, such as certain breast augmentation, certain types of procedures like that, versus there are some types of procedures that could be delayed for a certain period of time. If a patient is experiencing discomfort and the surgery should happen to relieve that discomfort, you may be able to delay it for 2 weeks or 3 weeks, but delaying it for 2 or 3 months may be problematic. But that is at the physician's discretion.
Yes.
Mayor Bowser, with this order, will you be asking DC employees where they've traveled and be taking action based on their answers?
I won't be asking them where they have traveled, likely, but we have always issued, when we issue guidance, we amplify that with our own employees, regardless of where they live. Yes.
If I could go back to the Nationals, Director Rodriguez, you have a letter back and forth with Gregory McCarthy with the Nationals about their protocol when a player tests positive. We saw Soto has tested positive, and I've read the letter. Are the Nationals in compliance with the desires, with your recommendations of how they should quarantine the people who were exposed to Soto?
So thanks for the question, Mark. So when we issued the waiver to the Nationals, the first waiver was on June 30th, and then you're referencing a follow-on letter on July 16th where we clarified our requirements and the requirements of DC Health. I can't speak to a specific case, but to date, the Nationals have been in compliance with our requirements, and for each case, the positive cases are reported to the DC Department of Health.
Is that the only case that a team has reported? Is that the team has reported to you? Can you tell us how many cases?
It's not the only case.
How many cases has the team reported?
We'll get that number for you.
And then, can I ask Dr. Nesbitt or the mayor, you talk about the possibility of rolling back or dialing back some of the restrictions. What has to happen? Is there a metric that we should look for that would trigger you making that move?
Mark, there isn't one, so we will continue to look at, from day to day, all of our metrics and make some determinations, but we don't have on this date, this number, no.
Is it possible that you might just dial back one of those bullet points that you find is particularly troublesome rather than all of them? Is that how?
Absolutely, that is possible.
If I could, Dr. Nesbitt, across the river in Fairfax, your counterpart over there, Department of Health, was just asked this question. I want to ask you the same question. If schools reopen, is it guaranteed that there will be a death related to that because of COVID?
There are no guarantees in COVID.
So what does that mean? I mean, she said the short answer is yes, that somebody would likely die if the schools reopen.
Mark, I think you've been following this very closely enough since March that you should know by now that there are no guarantees related to a pandemic, right? So we don't know what the trajectory of this virus will do in any community. And so that would be my answer, and I will stick with that answer. I've been asked in this room lots of different things. I've been asked, would we have to go back to, is it possible that we would have to go back to prioritizing who gets tested? This thing could change its trajectory in terms of the number of cases we could be seeing on a daily basis. We could see deaths change, how deaths change to any particular sector. I would never be pushed into a position to guarantee that anything would happen specifically related to a pandemic, whether positively or negatively.
Yes, Sam?
Yes, Mayor, you talked about schools quite a bit, and we've sort of learned what the surrounding counties are going to be doing. Have you decided yet what DC is going to be doing?
We will have that discussion next week, Sam. Yes.
We're reporting on a power outage at United Medical Center in Southeast DC, that ICU patients are being moved. Can you all discuss what the plans are? Are there any COVID patients involved in that movement?
I understand that the power is back on. Pepco had an outage yesterday, I think about 10 o'clock. I think that the Pepco issue has been resolved. We are still on site trying to resolve other equipment in the building, including the chillers and the backup generators, to make sure if the power is unstable again, that those generators can supply what we need. There were patients moved, and I'll ask Dr. Nesbitt to talk about that.
Sure. We made some transfers of this morning at United Medical Center, made some transfers this morning of patients from the intensive care unit which included patients who were on ventilators and patients who were not on ventilators. The Department of Health and HCMA both have staff members on site working collaboratively with hospital leadership, continuing to monitor the situation at the hospital. Power has been restored. We will continue to monitor the situation at the hospital as power has been restored. Other services are coming back online at the facility to see if additional patients will need to be transferred throughout the day.
Can you talk about how many patients and are any of those positive COVID-19 patients being treated?
They do have COVID-19 patients at the hospital. We'll have to get back to you as to whether or not the patients who were transferred, if they were part of the patients on the COVID unit.
Any one hospital that they're assigned to go to? if
They were
transferred?
transferred to various locations who could accommodate them.
Do you have a question, Julia?
Yes, I've gotten this question from people who are planning travel, asking whether they can quarantine before they come to DC. If they're in Florida, can they self-quarantine for 14 days in Florida and then come here?
No.
Well, Florida is the problem.
Just in their house in Florida,
No.
they still need to quarantine when they come here.
They're traveling, I mean, unless they're gonna. And Florida gets it, because Florida has had these restrictions, you know, they've already had it. Yes, a couple more.
We learned Congressman John Lewis is going to be lying in state outside because of COVID-19 and restrictions. Can you talk about, do you have any concerns, whether it be extreme heat or the pandemic, with people going to see him lying in state and pay their respects?
I do not. I haven't seen the plans. I haven't seen the plans, other than I think that he will travel through the city. So I can't comment on specific plans, but if you're saying, do I have some concerns about an outdoor viewing? Is that,
Going to the Capitol building to see him lying in state, yeah.
you said outdoors?
Yes.
I think that we would be less concerned about that, but Dr. Nesbitt stays in touch with the attending physician at the Capitol, and if we have any concerns, they'll communicate with DC Health and we to them. Yes.
Two quick questions. Mayor Bowser, can you tell us about your conversations with the governors yesterday, what came out of that? And then Dr. Nesbitt, at the risk of going too deep into the weeds, if we could get an update on community spread and exactly where we are with that.
I asked to meet with the governors. We had a phone call yesterday. We are one region, and we're a porous region, and everything that happens in Maryland and Virginia, I think, has some impact on us. From the activities, to cases, to testing, to hospital capacity, we had that discussion.
And are you guys all, do you feel like you're all on the same page with the DMV?
I feel like we feel a little bit more urgent about being prepared if the health data suggests that we need to roll back some activities.
You feel like DC has more sense of urgency than Maryland and Virginia?
I think that yes, I do.
Mayor, you said that John Lewis would be traveling through the city.
I think that there may be and I'm losing my words, but a procession for their cortege.
I'm sorry?
A funeral procession, so I don't know the route of it.
Oh, okay. But it's not like he's going to be moving around DC or something like that?
I don't know that,
From
Sam.
the airport to the Capitol?
I don't know the specifics of the route. That may be a better question for the Capitol.
Right. I thought maybe you knew something that I had heard. That's all.
All right, I just said to Stephanie, I didn't know the specifics. Okay, the last two. Yes, ma'am.
Back to the question about Maryland and Virginia. Can you talk about why the whole states of Maryland and Virginia are exempt from this quarantine order rather than saying, you know, if somebody goes to Virginia Beach or somewhere that's not in the DC region, they have to quarantine?
We want it to be simple for everybody to follow, and we recognize that if we have to make the restrictions more strict to the National Capital Region, that's certainly something that we can consider at a later date. Yes.
I know we've discussed budget a few times in these meetings. Any reaction, though, to the passing of the budget yesterday, and specifically what's reported, the paring back of funding for rental assistance and homeless service programs at this time?
I don't know that I would call it paring back, because the council increased, and I know they rolled back one of the taxes, but over the 4-year plan, before that rollback, they had increased spending by $300 million. But they had increased it by increasing revenues by that much. And so I haven't seen what that finally comes out to. But just to put that in some perspective, because of this pandemic, we have seen a decrease in our revenues by, I think the number is $1.5 billion for this fiscal year, and the one that starts on October the 1st. We presented the council with a balanced budget that it made some really significant investments in schools and affordable housing and in our social safety net, while at the same time we had a decrease of a pretty historic decrease in our revenues. So it was our position that a lot of programs and services got a haircut because of that $1.5 billion decrease in revenues. And those were necessary, tough decisions. So I will look more closely at what the increased spending that the council finally decided on yesterday. And I will also keep an eye on what we might have to do should revenues go down again based on an updated revenue estimate from the CFO. Okay, thank you guys.